Hi, everybody. This is going to be just a fairly short video, but an important one for many of you in looking at how we use concepts like concentration and even dimensional analysis to look at solution dosage calculations. These are calculations that some of you may actually be doing yourselves on a regular basis within just a few years, or even a shorter amount of time than that. So it's something that is fairly important for a lot of you. And so many oral medicines are presented or are given as solutions. And so we have to use concentrations as conversion factors in order to calculate how much of something to give. And so for an example here, we might want to know how many milligrams of Tylenol, acetaminophen, are present in just a normal adult dose of NyQuil. And so we could do a fairly simple dimensional analysis calculation for that. A normal adult dose of NyQuil, 15.0 milliliters. We also know, and you will find this information from the bottle or just other sources, but we know that there are 21.7 milligrams per milliliter, so milligrams of acetaminophen per milliliter of NyQuil, which would tell us that in a normal adult dose, we get 326 milligrams of acetaminophen. Now, again, that might be valuable information to know if you're tracking or you want to know how much acetaminophen that you're giving a patient, but they're also getting some NyQuil or they had some NyQuil recently. So you want to be able to factor that amount of acetaminophen in. Here we have an example for an order given for 60 milligrams of Tylenol administered to a patient every 4 hours. You get the Tylenol from the pharmacy though, and it's given as a 40 milligram per milliliter solution. And so you need to find out, you need to calculate how much of that Tylenol solution should actually be administered every 4 hours. So you've got the 40 milligram per milliliter solution. How much of this do I have to give to get the 60 milligrams? So again, some fairly simple dimensional analysis. We have our 60 milligrams that we need to give, but then multiplied by our conversion factor of 1 milliliter of our Tylenol solution per 40 milligrams. So again, we can see here that there's 40 milligrams per milliliter. Remember that conversion factors can be used however you need to use them. And so we were told that this Tylenol solution was 40 milligrams per 1 liter. And we can write that in either way. Sorry, not 40 milligrams per grams per liter. 40 milligrams per milliliter. That's better. And so a 40 milligram per milliliter solution, which means that we can use that conversion factor in either direction. And we know that in this case, we need to use it the second way that I have it written, so that our milligrams cancels out and I'm left with milliliters because that's how the actual solution is coming to us. It's coming to us as a liquid solution. And so we need to know how many, sorry, my screen sharing got paused. I hope that didn't mess anything up. So we need to know how many milliliters of that solution that we need to actually give. And so we do that out and we see that every 4 hours, we need to be giving this patient 1.5 milliliters of the solution. You might also need to do calculations involving the concentration of an IV medication and a flow rate. So a flow rate is equal to the solution volume, the necessary volume of solution that needs to be given over a time factor. And so doctors will often order a rate of medicine over a period of time. And so we would have the rate of the medicine prescribed is equal to the solution mass over the time scale that we're looking at. So we can see how that works out here. Our solute mass divided by our solution volume. So there's our concentration multiplied by the volume over time would give us our solute mass over time. And so our concentration times our flow rate is equal to the rate that the medicine is administered at. Inverted concentration So if we take our volume over our mass and multiply that by the rate that the medicine's administered, that equals our flow rate. And we can see an example here. So a patient receiving 30 milliliters per hour of an 8 microgram per milliliter solution. We want to know how many micrograms per hour the patient is actually receiving. So again, remember that our flow rate, 30 milliliters per hour or 1 hour per 30 milliliters, dimensional analysis, conversion factor, use this however we need to, same as our concentration, 8 micrograms per milliliter or 1 milliliter per 8 micrograms. And we can see that we would need to set this up like this. So our concentration, our 8 micrograms per milliliter, times our flow rate of the 30 milliliters per hour equals the rate that this medication is being dispensed. And so that means that this medication is being dispensed at 240 micrograms per hour, which is very important information that you might need to know. And so if we're giving a patient 30 milliliters per hour of an 8 microgram per milliliter solution, they're receiving 240 micrograms of their medication every hour. Another example here, droperidol, medication used to treat post-op nausea. So we have an order here given to administer 0.275 milligrams over 3 hours. The solution has a concentration of 2.5 milligrams per milliliter. So now you need to know where you need to set your flow rate. So again, this is something that might be a very important thing to know how to do. Nurses, PAs, people, different people in hospitals are setting up IVs all the time. And so this is something that you might legitimately have to do, is set the flow rate of the IV. And so here we can see that this calculation, we have our inverted concentrations. So eventually we want units of milliliters per hour. So we can see that we're going to want our milliliters up top. So our inverted concentration, there's our 2.5 milligrams per milliliters, but we invert that so that milliliters is on top per 2.5 milligrams. Here's the rate that the medicine is administered at. And so the order was given for 0.275 milligrams over 3 hours. So 0.275 milligrams over a time of 3 hours tells us that we want the flow rate of this IV to be 0.037 milliliters per hour. And so I like to give this little presentation for sort of the real world setting. I mean, I know a lot of you are sitting there thinking things like, why do I have to take a class like this? Why do I have to take chemistry? For many of you, this is exactly why, or this is one of the reasons exactly why, is that you'll need to be able to know how to do the calculations, or even if you just want to double check and make sure that somebody else did it right so that you're not giving patients a lethal dose. These sorts of calculations are important. And so you need to know how to be able to work some of these and how to do them. And so that is all for our dosage calculations. Thanks for watching.